Good afternoon, everyone. Can we have the slide? Yeah. The WHO's 75th anniversary year is an opportunity to look back at public health successes that have improved quality of life during the last 7 decades. It is also an opportunity to motivate action to tackle the health challenges of today and tomorrow. World Health Day is celebrated globally on April 7th every year to raise awareness about physical, mental, and social wellness. It is an initiative of the World Health Organization to promote health and well-being of all individuals. Nutrition, exercise, relaxation, and sleep, as we all know, are the pillars which work together to keep your mind and body healthy. With these little words, today we have a very eminent personality, Dr. Sadhana Joshi, a passionate researcher who will be taking us through her work on women's health. And before we start introducing Dr. Sadhana, I would like to briefly give an outline about various activities that we have taken up in this particular year under NSI Mumbai chapter. Can you change the, yeah. So Nutrition Society of India has been established in 1967, is an association of nutrition professionals, programmers, and policymakers from India and abroad. The recognized Indian representative of International Union Nutritional Sciences through the adhering body, Indian National Science Academy and Federation of Asian Societies of Nutrition. Can you please click? Yeah. The society is dedicated to disseminate the results of the latest research in nutrition, basic and applied aspects, also to analyze the current status of nutrition programs in this country, and also recommends appropriate strategies to promote nutrition of the community at large. NSI Mumbai chapter is very proud to announce and is a very active zonal chapter, and we received an appreciation award for activities conducted during the lockdown. And thanks to all of you for doing this. Activities undertaken since April 2022 include: we had World Health Day programs in collaboration with Dr. BMN College and College of Home Science Nirmala Niketan. And these are the brochures made for on that particular day. And we had so many various areas covered under the same heading. Next, we also had other programs in collaboration with Anjuman Islam College of Home Science. And we also represented in USA Dry Pea and Lentil Council. The other programs include Mega Health Camp, which was organized in collaboration with NGM College from 23rd to 31st of May. And there was a very nice field trip arranged for this. Next, we also had Yoga Day celebrations in collaboration with Dr. BMN College of Home Science and Lifeness Science Institute. As you can see, the webinars in progress as well. World Breastfeeding Week activities were taken up by many colleges, which include LSI, along with Nirmaya Health Foundation and Rotary Club of Garden City, Mumbai. We also had MGM School of Biomedical Sciences taking part in this, with Department of Home Economics, Srimati Maniben MP Shah Women's College at Wadala Gate. We had with Anjuman Islam College of Home Science, and Department of Postgraduate Studies, MSc Clinical Nutrition of Dr. BMN College also had a very good program on World Breastfeeding Week. Next, we had Rashtriya Poshan Ma being celebrated with a webinar by Kellogg's, which was on food systems approach towards food and nutrition security. We had state level and national level essay writing competitions organized for the students as well as working professionals. And we had a webinar organized on Forgot Vegetables of India with P.N. Joshi College. Next, nutrition awareness programs at ICDS Center Khopoli in collaboration with MGM were taken up. Inter-college recipe contests were conducted at MGM Institute, and a workshop of fundamentals of complementary feeding was organized. Apart from this, we also had a webinar on role of diet in female hormonal issues for girl students of home science of Anjuman Islam College. Two-stage inter-college quiz competitions was conducted by Food Safety and Standard Authority of India, which was very well accepted, and they wanted many more such activities. Nourish India, a national level seminar was taken up by Dr. BMN College, which again was a resounding success. Webinar on gut to womb, recent updates in gut health for maternal and child health was organized in collaboration with Sir Vittal Das Thackeray College of Home Science. World Food Day, we had a pan-India quiz competition and along with Lifeless Science Institute. This year, in the month of January, we had Posticon in collaboration with Nirmala Niketan College, MGM School of Biomedical Sciences, and NSI Mumbai on the 27th and 28th of January. Benefits of becoming an NSI member is get an opportunity to present papers at National Conference of NSI, as we could see in Posticon that many of you had participated. Get student discounts for certain conferences and seminars organized by NSI, and we could also introduce you to furnish a lot of social media articles for us. So please do join and visit NSI India website for your membership details. And lastly, follow us on social media handles. All information regarding NSI Mumbai activities, events, workshops, webinars are published, and we would love to have you with us forever. So please do join NSI. And now let us come to the personality of the evening, Dr. Sadhana Joshi, and to briefly introduce her, she has some excellent work done, and she is a very passionate researcher, and she holds a PhD in nutritional biochemistry from Agarkar Research Institute, Pune, India, director, great scientist, and heads the Division of Mother and Child Health at Interactive Research School for Health Affairs, Bharatiya Vidyapeeth University, Pune. She has been working in the area of mother and child health for over 25 years. Dr. Joshi has several novel findings to her credit, which are published in 160 journals, with a large number being published in international journals. The group has received a large number of grants from various departments of the Government of India, like the DBT, ICMR, and DST. In addition, there are a number of student projects, junior, senior research fellow, and research associate, which are funded by the ICMR, DST, and CSIR. Principal investigator on an ICMR Center for Advanced Research, where she will examine the associations of maternal long-chain polyunsaturated fatty acids and micronutrients with clinical outcome in pre-eclampsia. Life member of various national and international organizations of repute. 9th Dr. Rajamal P. Devadas Memorial Award was won by her on the 50th Annual International Conference of the NSI 2018. Research Excellence Award for Developing Country Scientists at the 7th World Congress on Developmental Origins of Health and Disease, Portland, USA. And I have the next, yeah. Best Researcher Award at the 15th Foundation Day ceremony at Bharatiya Vidyapeeth University, Pune in April 2010. Editorial Board Member of Journal of Nutrition and Intermediary Metabolism, Elsevier. Reviewer for various international journals with high impact factor. Member of the task force at DBT and expert reviewer for ePromise, DBT, ICMR, DST, SERB. She has been nominated on the expert committee on wellness counseling formed by the state project director, Rashtriya Uchchatar Shiksha Abhiyan, Rusa, Maharashtra in 2017. Board member for the Preterm Birth International Collaborative Pre-Big Australasian branch. She was invited to participate in the 2016 Grand Challenges meeting sponsored by Bill and Melinda Gates Foundation at London. She has also been invited to deliver talks at several national and international conferences, World Congress BCGIP India, Annual Congress of Society of Fetal Medicine, Nutrition Society of India, Indian Dietetic Association, and a number of other international and national conferences. A total of 16 students have obtained their PhD degree under her guidance, and 6 others are currently pursuing their PhD. an invited member of the Fellow of the Society of Applied Biotechnologists, member of the board of the Indian chapter of Gestosis, the Indian Society of Preeclampsia, life member of the International Society for Developmental Origins of Health and Disease, life member of Nutrition Society of India, and life member of Society for the Natal Effects on Health in Adults in India. It's a very, I think, very interesting resume that I have read, and I feel that she can inspire you all in the area that she works in, maternal and child nutrition. So let's, without wasting any more time, I would like to now invite Dr. Sadhana Joshi, who has inspired me, and I've heard her. She really delivers something and can give you a lot of take back messages for all of us to follow. So Dr. Sadhana Joshi, thank you once again, and would love to hear you.
Thank you, Dr. Anuradha, and all the other office members of the Nutrition Society of India Mumbai chapter. At the outset, I think I must congratulate you all on the excellent work that you all have been doing and winning awards at the NSI for the best chapter of NSI. So heartiest congratulations to all of you. So to just share my slides, can I share my slides now?
Yes, ma'am.
Is it visible?
Yes.
Yeah, so once again, a very good afternoon to all of you. And today, actually, after Dr. Anuradha spoke to me, I was a little wondering what I should speak on. So I just thought, since the topic was on women's health, I thought I'll just briefly take you on the importance of women's health. And my today's title is Improving Women's Health Will Improve the Health of the Future Generations. This is the concept of developmental origins of health and disease, concept on which we at IRSHA have been working on for the last 2 decades. So we all know women as leaders doing well in all their respective fields. You know, women as doctors, engineers in the defense field. Very recently, a lot of people are in defense, research, education, hotel, hospitality management, and of course, many such more. So overall, women are doing extremely well as in their professional lives. But when you look into the health status of women, is the report card as good as what we saw in the earlier slide? Unfortunately, no. Because you can see over here that every 5 minutes, a woman in India dies from pregnancy complications during childbirth. Secondly, India tops the list of countries with the highest number of child deaths. Over 50% of adolescents in the age group of 10 to 19 years are short, thin, overweight, or obese. And the recent NFHS survey shows that around 50% women are anemic. Add to all this, we also know that globally, 73% of the deaths among women are due to non-communicable diseases. So why is it that there's such a heavy burden of NCDs in women? There could be different reasons. One would be physiological hormonal differences, lack of knowledge, different socioeconomic factors, poor lifestyle and choices, and of course, most importantly, late diagnosis and inadequate treatment, because the woman is the last priority. She comes only after all her other priorities are met. We know that women in the low income and middle countries are often at higher exposure of non-communicable disease, a very recent WHO report. We also know that CVD caused around 8.8 million deaths among women. Same whole story holds true for cervical cancer. It's no different. So overall, one can say that the risk of non-communicable diseases is very high in women. What are the different risk factors? We know nutrition plays an important role. We just now heard about physical activity, overweight, obesity, alcohol, and tobacco, more so in the urban population, where you find young adolescent girls taking to alcohol and tobacco use. Now, this is something which is very basic. If I have to focus on nutrition, I think all of you know this, that the nutrition and health of an individual are very closely linked. The intricate interactions between the diet and many aspects of human health are very poorly understood. Now, nutrition, we know, can play an important role across all the life cycle of a woman's, that is right from childhood, puberty, maturity, menopause, and the old age. And if you do have a healthy diet, we also are always told that it will help you to protect against the non-communicable diseases. Now, during the different phases of life, the habits which you establish during adolescent age is likely to track into adulthood. So here I would like to mention that you need to have good, healthy eating habits. Preconception nutrition, of course, is a very thing, because it increases your chance of natural conception and it gives you a healthy start to pregnancy. Pregnancy, of course, optimal diet will help you to reduce the risk of various pregnancy complications, leading to optimal fetal growth and development. Postnatally, it will help in improving lactation, support the growth of the baby. Although we know that the nutrition and health are very closely linked, as I mentioned just now, this is known right through many decades. However, the intricate interactions between the diet and the many aspects of human health are very poorly understood. Why is it that nutrition is so important and how does it influence health? So we at Irsha try to understand the basic molecular tools through which maternal nutrition can influence the health of the offspring in adult life. This is a slide, I think the pyramid, all of you are aware of, right from our early school days, we have seen this. So I won't go into that. I would just like to mention here that right from early pregnancy, if you do consume a balanced diet, it will help you into having a better pregnancy outcome. There are very many nutrients which are important during pregnancy, macronutrients, micronutrients, and of course, during pregnancy, there is an increased need for both macro and micronutrients, which help into a healthy pregnancy outcome and the well-being of both the mother and the fetus. So you know about the other micronutrients. However, the long-chain polyunsaturated fatty acids, that is the LC-PUFAs, has been given very less attention. And here, hence, I would like to mention here that we need to focus on these long-chain polyunsaturated fatty acids, because these LC-PUFAs are of two kinds, that is the omega-3 and the omega-6 fatty acids. They are further subdivided into a number of different fatty acids like DHA, docosahexaenoic acid, eicosapentaenoic acid, and alpha-linolenic acid, which is the precursor to this DHA and EPA. These omega-3 fatty acids are anti-inflammatory in nature, whereas the omega-6 fatty acids, that is the linoleic acid and the arachidonic acid, are pro-inflammatory in nature. Now, these become especially important during the pregnancy because the fetus has a very limited ability to synthesize these LC-PUFAs. Now, these LC-PUFAs are required during all the reproductive stages. They are important during the preconceptional stages because it helps you to begin pregnancy in a healthy state, during all the trimesters of pregnancy, and of course postnatally, because the baby's nervous system which develops requires both DHA and AA, and the brain is made up of 50% of these polyunsaturated fatty acids. I would like to take you through this current slide because the importance of this slide being that the profile of the fatty acid intake has dramatically changed from maybe a couple of generations back, where we used to have a diet which was rich in omega-3 and omega-6 fatty acids in the ratio of 1:1. Slowly, the ratio kept changing, and currently the omega-6 fatty acids are predominant in the diet, with the result that the omega-3 fatty acids are very minimally present. They are mainly found in the non-vegetarian sources. So as a rule, most of the vegetarian or vegan population does not have omega-3 fatty acid in the form of DHA or docosahexaenoic acid. What we do have is the alpha-linolenic acid, and this is mainly found in green leafy vegetables, rajma, and if you have lower consumption of green leafy vegetables, you black gram dal, so you automatically have lower amount of omega-3, further leading to an imbalance in these kind of fatty acids. At the same time, there is an increased consumption of trans fatty acids, lot of people eating outside, increase in saturated fatty acids. So the proportion of all these important fatty acids have changed, and these fatty acids induce epigenetic changes which have been related to neonatal and pregnancy outcome. This is one slide which I would really like to show you, that imbalanced nutrition, especially these kind of fatty acids or any other vital nutrients, will lead to a spectrum of adverse pregnancy outcomes. So this concept of maternal nutrition playing a key role in the developmental origins of health and disease through epigenetic regulations has come into focus since the last decade. Now, what is epigenetics? If I may say, it is how your diet can modulate. This epigenetic changes occurs because of interactions with the environment. It could be radiation, nutrients, different drugs, which can produce immediate or long-term effects. And nutrition is our major focus, and it has been shown through a series of our animal and human studies that it plays a key role. Now, epigenetics, as I mentioned, is a study of heritable changes in gene activity, which are not caused by changes in the genome. Now, there are different nutrients influence these epigenetic micronutrients. You will find that they are involved in the one carbon cycle, where they donate methyl groups and they influence methylation patterns. Now, methylation patterns could be either your DNA, DNA getting methylated, or your histone getting methylated. So nutrients, they modify the epigenetic phenomenon and alter the expression of genes at the transcriptional level. So this is once again saying the same thing, that maternal nutrition can play a role in developmental origin through different epigenetic regulations. There are different critical periods, and how nutrition during these periods influences the health of the offspring. It is during the preconception page, during the prenatal page, when you period when you are pregnant, postnatally. So different micronutrients have different roles to play. I wouldn't go into these details. Animal studies have demonstrated adequately that nutritional manipulations during pregnancy can result in an adverse pregnancy outcome, but also have lifelong consequences in terms of insulin resistance, elevated blood pressure, and cognitive defects. Now, there are different phases, so how right from fetal life, childhood, adolescence, adult life, they can influence the fetal programming. Overall, I would like to mention here that the programming of health begins much before birth, and it is not only restricted to one generation, but it is also subsequently translated to multiple generations. These original studies came from Professor David Barker in the UK, who put forth the fetal origin of adult diseases, mainly where he showed that the Dutch famine, where babies exposed to famine in utero were at increased risk of non-communicable diseases in later life. And then this was an animal study which showed that by changing the nutrients, it could change the coat of the rat from, it is an agouti mice, where it changes from a yellow, which was susceptible to obesity, and a diet which is rich in methyl donors shifted the coat color, so yellow to brown, showing very clearly that nutrition influences the phenotype. So the epigenetic environmental influence on gene expression that modifies the genetic message without specifically altering the gene sequence. So nutrition then becomes a new bridge between nutrition and health through epigenetic changes. There are different factors. I already mentioned to you about these: folate, B12, long-chain polyunsaturated fatty acids, and the way that they can modulate epigenetics. These changes in epigenetic patterns through the mother are mainly through the placenta, which is an organ which is formed during pregnancy, which connects the mother, and the nutrition of the mother is given to the fetus through the placental tissue. I wouldn't go more into this. The moment your mother's diet changes, there are alterations in the placental, different functioning of the placenta leads to an abnormal placental development and thereby abnormal fetal growth. So all our studies, we have very adequately demonstrated in terms of maternal micronutrients like folate, B12, and then they increase your homocysteine levels. You have lower levels of long-chain polyunsaturated fatty acids. It can reduce different expressions of angiogenic factors, which are required for the angiogenesis to take place, the absence of which leads to high blood pressure and conditions such as preeclampsia during pregnancy. So overall, it can influence your placental vascular development and The children who are born to these mothers with preeclampsia, they will have risk of neurodevelopmental disorders in later life. So the impact of altered nutrition on women has not only both short term in terms of pregnancy complications and poor birth outcome, like preeclampsia, it could be gestational diabetes and a whole lot of other complications. But it also has a long-term risk in terms of cancer, diabetes, etc., making it very important to have optimal nutrition during pregnancy. So we know here that the brain, I already mentioned to you, develops when the fetus is in utero, mainly requires the long chain polyunsaturated fatty acids. So if you have less amount of long chain polyunsaturated fatty acids, bound to influence the period of brain growth, development. It influences neurogenesis, proliferation, synaptogenesis, etc. So what we did is we tried to see whether the children who were born to mothers with preeclampsia, whether they had any impairment in their cognitive function. Here, mind you, the child is following an optimal diet or a diet which is given to the rest of the family. So the only insult over here is the mother had high blood pressure during pregnancy. You can see here when we followed up the children, the anthropometric measurements, that means the child is born small, but later on has a BMI, which is much higher than a normal child. The cognitive ability of that particular child is impaired. If they had higher weight, height, then they had subscapular skin fold, etc. They were much higher. They were in the higher tertiles of blood pressure with increased systolic and diastolic blood pressure as compared to that of the control. So making it very clear that what the insult that takes place during pregnancy not only has a role in just short-term consequences, but it is following up in the children subsequently into adult life. So I already mentioned here that the child becomes at high risk of NCDs, cognitive impairments, there's wasting, stunting, etc. So I would like to say that nutrition influences epigenetic patterns and the health of the future generations. Therefore, you need to inculcate good eating habits, because these micronutrients or these different macronutrients can have differential effects on epigenetic modifications. It's a very hot field at present. There are a whole lot of people who are working into methylation of the DNA, histone modifications are going, microRNA regulation. There are a whole lot of molecular tools that one can look into. And only if your diet during your early life is good, it will result into healthy adults leading to healthy generations. To add to this, I would just like to say that India is a signatory to the Millennium Development Goals, where the major focus you can see over here is on maternal nutrition, improving the overall health of the mother, the mother's feeding, caring habits, access to nutritional diet, including both micro and macronutrients, and this reducing the risk of complications such as preeclampsia and eclampsia is one of the major focus areas of the Millennium Developmental Goals. So Government of India has a number of programs which are ongoing, and these are, like I have just listed, the Janani Suraksha Yojana, Pradhan Mantri Surakshit Matritva Abhiyan, etc. But the onus is on the female child right from early childhood to have a good optimal nutrition, to take part into different physical activities. Only then we would be into a generation which is healthy. Now, for all the my take-home message would be our health in early life plays an important role in deciding our adult health. Now, for all the younger generation girls who have joined this, I would like to say nutrition is something which is not to be taken very lightly. If you all are doing these courses of nutrition, short-term courses, of course, are okay that they just influence, they add to your knowledge. But nutrition is a professional course where you must go for these master's degree, and it's not doesn't end just with a master's degree. As I mentioned to you here, there's a whole lot of field which is opening out in terms of having research where you can do your PhD, you can do your postdoctoral studies. And it is not only the nutrient where, very traditionally we knew only about few nutrients and the importance of these nutrients. So it is very clearly now demonstrated that these particular nutrients can have a whole lot of molecular mechanisms through which it can take you to a healthy generation, not only to one generation, but to subsequent generations, making it that it's a very wide field which is very open to all of you. And those of you who are interested, I would suggest that you must get into this field, because it's very exciting that it's not just, what you learn during your bachelor's, master's, that's the end of it, but you can explore much more, you can interact. My group basically comes, most of the girls are from the background of biochemistry or biotechnology, they have imbibed this background. It is very easy. You have your basis very strong, and you can understand these molecular mechanisms and contribute to the health of the nation. So thank you very much. And I hope to take any questions if any are there.
Thank you. An excellent presentation, madam. And I think you did justice in the time frame that we have given it to you. But I know it's such a never-ending topic. We can go on and on. But simply to ask you one single question is that if I become pregnant, what are the things that I need to look at my own goals? Because today, when I look at so many girls, they are primarily deficient in some of the nutrients. Most of them are deficient in some of the nutrients. Am I audible, Amrita?
Yes, ma'am. Yes.
Yeah. So, is there any way in which we could look at our own health to probably make sure that we keep a track of whether we should become pregnant or not, or take some kind of measures to have a better delivery or better, because I think you did a lot of work in this particular area. So are there any, you have definitely highlighted that please look into your folic acid, your B12, your long chain PUFA, but what kind of health issues should we be very careful? Because when you see so many deliveries today, we see a lot of preterm deliveries today, which are very, very, I don't know, very dangerous kind of deliveries which are happening now. So if you can throw some light on how to send some markers within us to proceed with this pregnancy.
I think ma'am is on mute.
Sadhna ma'am, you're on mute.
Ma'am.
I think there's a
Relay is frozen, freezed.
Okay.
Yeah, I would like to mention here what happens in the current. Hello.
Yes, ma'am. Yes, ma'am.
Yeah, what happens is due to the fast lifestyle and one concentrating more on professional lives, there is a negligence towards your dietary patterns. So you are more consuming fast foods, which are very rich in trans fats. They influence the different methylation patterns. So I would suggest that one consumes a normal diet, which consists of, adequate diet in terms of macronutrients, micronutrients, paying specific attention to the polyunsaturated fatty acids, as I mentioned, because in the vegetarian or in the Indian population, among the whole globally, we have the lowest levels of DHA. So that too plays an important role in influencing pregnancy outcome. So I would say that one should focus on these polyunsaturated fatty acids, reduce your intake of trans fats. Saturated fats, of course, we all know that needs to be reduced. At the same time, pay specific attention to micronutrients like folic acid, B12, calcium, magnesium is another, which is also, we have shown in our studies, is lower. So I would suggest that one needs to look into all these nutrients.
Fantastic, ma'am. I think I could also add one more thing is that when we are pregnant, we come to know only after the second month. So you have to be much, much more careful. So when you are preparing for pregnancy, much before that, I think 6 to 1 year before that, I think your nutrition needs to be regulated.
Yes.
And that's what
I would go one step further and say right from the adolescent age itself, if you can take care, and that will help you in preparing. Adolescence is one phase where no one thinks about pregnancy. It's too far away a period. So at least as close to pregnancy as possible as you may.
Yes, I think that is very important, and that is the message that we would like to give you.
If you can take care of your health.
Any other questions if anybody has? Because ma'am has done an excellent amount of work in this particular area, and I know that feeding the mother early on has a wonderful outcome later on in your life. So if you want to have a healthy baby, please take care of your nutrition, and also pass on the message to as many as possible that nutrition is the way forward. So thank you once again, ma'am, for delivering such a lovely lecture. And now I would like to pass it on to Amrita to take the webinar forward.
Thank you very much.
Thank you, Anuradha ma'am. And now we'll go on to the second part of our program, which is the panel discussion on career opportunities in nutrition and dietetics. And I think it's a very apt topic. I have been teaching for the past so many years, and the question that constantly comes from students when they're nearing the end of their third year, or if they're in the postgraduate and they're nearing the end of their second year, the constant question is, ma'am, what is it that we can do now? Where is it that we can, what are the career opportunities available? What are the various options available? So while we can tell them a few things in class, we can invite a few resource persons over. I think the initiative taken by the NSI Mumbai chapter is it's a very timely initiative in that we have brought to our students who are viewing this this session on either YouTube or Zoom. We've got a bouquet of professionals who completed their graduation, post-graduation, and further education in nutrition to interact or share their life journey with all our participants, to tell us what are the options available, what has been their journey, difficult or how easy, or what were the challenges, how were the challenges converted to opportunities, and how nutrition and dietetics has a very wide scope. It always had, and the scope is ever expanding. The field is so dynamic. So we have a very good assembly of nutrition professionals over here. We have Ms. Purabi Mahajan, who is a senior clinical dietitian at the Tata Memorial Hospital. We have Ms. Kajal Bhatia. She's an entrepreneur. She's a founder of Plant Power in Mumbai. We have Ms. Shreya Adhav, who is a sports nutrition specialist. She's a founder of Spur Eat. We have Dr. Lakshmi Menon, who is an academician and assistant professor at Dr. Meeman College of Home Science. She's teaching the master's program. We have Ms. Bansari Rao, who is the founder of the Nutrition Insights magazine, which is talking about how nutrition information dissemination, valid nutrition information dissemination can be done through various media. We have Mrs. Neha Arora. She's a public health nutritionist and a state program officer with Nutrition International at Gandhinagar. And we also have a very, very important aspect which will be covered today through Dr. Neha Sanvalka, who has explored the field of research and opened it up, and can inform us about the various scopes available as far as the research field is concerned. We will begin with Ms. Purabi Mahajan. She will share her life journey with us. She's a senior clinical dietitian, and this is a profession which I think most students would say, what do you want to do after you finish nutrition? I want to be a dietitian. So Purabi ma'am will tell us what it is to be a clinical dietitian, what are the challenges, how exciting the job is, and how you can constantly evolve through this. So welcome, Purabi.
Thank you, ma'am. And I would firstly like to thank the organization NSI for inviting me for this forum. So yes, being a clinical dietitian is very challenging, and I will share my story right from the time from the student age as I got my job. So you will get to, because there are a lot of changes due to the evidences and the changes that the patient, the medical fraternity is demanding on the clinical nutrition. So basically still the qualifications for clinical nutritionist is that you require post graduation, whether a PG or an MSc diploma, because you require the experience on the case specifications that you see the patients, right? So at least post-graduation degree is required with the preference of RD, which is there, where they ask for a permanent dietitian to come in. So as I got appointed in Tata Memorial Hospital, it's been 22 years. So initially the phase, if you can see, I think so clinical dietitians came into existence from 1900. That is the era where they started. So we used to look up for the hospitals, right? And where it was covering the NCPS process, where we started monitoring the patients at the OPDs and the IPDs to come in. And my organization is a very good blend of a semi-government organization. So what happens is, as right now, that's what we started seeing is the inpatients. Initially, it was first, that is management of seeing the supervision of the diets, which were there given to the patients, then going clinically to the wards and planning diets according to their requirements, which has been taught in by our teachers, right, initially. And then keeping a follow-up with it. But as the years passed, there was a lot of evidence-based demand which came in. So along with this, we had a variation of, when you see the inpatients, initially the general patients are very compliant, you may say, because they listen to you, right? But then when it comes to the private patients, slowly there was an awareness which started developing in the patients which were there. And so I must say, girls, that you should never stop, learning or getting yourself updated. Okay, because it is a classic example that I'll give you. I'm very blessed for the organization I represent, because right from the day one, our organization or our doctors never wrote dietitian reference for so and so calories and so proteins. They used to leave it just dietitian reference. So it was you who will you have to analyze your own case. You should be updated for that. Okay. And so for the update and for the upgradation, that is the knowledge that you have. What happened was, during this time, there were a lot of guidelines which came in. Okay, so there are a lot of these associations, the international associations like the ISPEN, that is the European Society of Enteral and Parenteral Nutrition, the American Society, which is there. So which helps the dietitian to take a guidance for her case scenario. It is not you have to ditto copy what it is, because you are the best person to analyze, because you follow up your patients every day with the clinical aspects of your biochemistry and the anthropometry and the follow-ups that your patients give. So I must say that as you go on, as you get your jobs, you must also update your knowledge. And there are now various ways of updating it. So the way of updating is getting associated to these organizations. And right now, to the web media which is there, you easily get it in your fingertips. Okay. And then the second, as I mentioned, is getting updated, getting connected to the various organizations which are there. Now, that's how you'll get updated. For example, take the national organizations which are there, like NSI. They have provided you with a lot of workshops on statistical data which is coming. Okay. Then we also have IDA, which gives you the diabetic educator program, which is there. There is also FODMAP, which comes in. Okay, so the FODMAP is usually a specialized program for the IBS patients which are coming up, as well as the Association of IPM India, which is there. It gives you also, there are a lot of modules, okay, which is specified in it. There are specialized areas like pediatrics, which is there, which is critical care, which is there. So that helps you to update your knowledge. Okay, so now bringing this, because I never stop learning. I still keep on updating myself as and when these new opportunities come. Okay. So this is how I'm telling you. So these are the references that you may help. Okay. So once you get associated with these associations, you will get updated by whatever new modules are there presented. So once you do this, what it does, it helps you, because that fright which is there as a dietitian, even as an intern when you enter the hospital, that you, expressing yourself or discussing the case with the doctors. See, the doctors here are they very much welcome you. So there was an area where only the doctors used to give a reference to dietitian. The dietitian to see the patient, it is to go back to the doctor, to the clinic as it comes. But right now, during the phases, as we get updated, we as clinical dietitians, we get updated with the latest current evidences which are there. They take you into the discussions. So now after 10 and 15 years in our hospital, where we have a checklist, that is the first the patient gets into the assessment of the clinical examination given by the patient, then there is a JC, a joint clinic discussion, which is there, where the exact diagnosis of the patient is done. And girls, I must say, the clinical dietitian plays a very important role there, because she starts the screening and they give you the consideration there, because for every unit, because we have various units. I represented the cancer hospital. We have different departments of thoracic, GI, geriatric, which is there. So for this JC, the dietitian is also called to discuss the case. That is when you will be starting. So this is one of the recognitions that a clinical dietitian has now got. Okay. Then again, dealing with the patients when it comes IPD, you have to be, as I said, you should not rely. Initially, we used to say what the doctors used to tell and follow. But right now, because of this upgradation that you do at your level, you can make your own protocol depending upon and the checklist how you will be seeing the patient. Again, an experience of a clinical dietitian is at the OPD levels, when you're doing the evidence-based screening assessment, which is there and which is possible. Okay, you get more confidence into it. Okay, then there's again, you also play a role of a counselor, because when it comes, you understand how to deal with a private patient. Okay, we have to maintain our ethics, which is there, as well as when you're dealing with a general patient, you have to plan your diet within your limited resources, which is there. Okay, so you don't have varied resources which are there where you can incorporate your functional foods and everything to come in. Okay, so this is also one of the parts. Along with this, then came an era as I stepped up into our follow-ups, was a research dietitian function came into the process, because along with the regular practice of seeing the patients, the data, there was a recognition by the various conferences, even again, these associations, where they really uplift you. Okay, so you also play a very important role indirectly as a research dietitian, where you have to upgrade and document your patient data, which is there. Okay, so once you start documenting your patient data, you get an easy database which is there, and you represent your organization and your practice. That is your hard work. That is through the evidences that you've done. So you represent it to add into these conferences where they give you your abstracts. There are lot of competitions where they encourage you right away, as you saw the presentation that Anuradha ma'am had given. So these organizations keep on giving you award also, which gets you recognized on the basis of your evidence which is there. Okay, along with this, what happens is, with the practice which is there, then thanks to the media which came in, the process of COVID which came teleconsultation. So it was not the limitations where only the clinical dietitian could see her hospital patients, right? So you had again a database to deal with the clients which were not visiting the hospitals and dealing with the clientels which were coming to you. Okay, and along with these big organizations, what happens is, once you start updating and joining yourself, came an era of specialization. So if you go to see specialization, because now due to the demand, there are specialities of core groups which are becoming more evidence into the medical fraternities. So you have a core group of pediatrics, you have a core group of the critical care, which is there. There is the heart, the cardiac critical, the oncology, which is there. So when you get associated as a clinical dietitian to these, they also help you out to the practices happening everywhere. And earlier, 10 years back, as I told you, we used to refer to guidelines. And I must say now, evidence-based, one of the organizations that I am attached to, that is IIP in India, okay, we are very much blessed by the visionary of our Vice President Nutrition, Mr. Shiv Shankar. For the first time in India, we have come with a clinical oncology nutrition consciences Indian-based, which is there. So it is very much helpful that there only the experiences of the clinical dietitian helps, because she has, so when all you get collated, that is your knowledge, that is your perseverance, that is your upgradation, which is there, your data as a clinical researcher, which happens, then you can develop all these RCTs, which can help you to come out with this consciences. So there is, the sky is the limit, as I might say. So at present, that is when you start, please, I will say that keep on updating yourself. And right now, the scenario is a clinical dietitian can represent herself as a teacher, because she gets, because there are these educational academic organizations which have come up with practical based programs, certified programs, which are there. So there also you play an important role. You play a very important role even as a person in setting up these guidelines. Okay, and one more thing that I will tell you all, that is sky is the limit for it, as well as there are future plans also. There are branches which are coming up, because if you see, a clinical dietitian now is still not stuck to hospitals. There are these Indian wellness companies which are there, who are demanding for clinical dietitians, because there are clienteles online that they're getting, right? Then you also have these beautiful social media groups where an individual entrepreneur clinical dietitian can set up a business and get these clienteles which are there. There are lots which are there. So there is Flitterfly, there is Healthify Me. Then there is also, NGOs which encourage clinical dietitians. For example, Curdles Foundation, which is there. So it is a non-profitable organization which takes up clinical dietitians for taking a holistic, nutritional, practical approach of taking care of cardiac and oncology patients. So there is a wide opportunity, that I may say. Thank you.
Thank you very much, Purvi, for telling us how the role of a clinical dietitian has evolved, why she should be versatile. She also has to be she has to be a planner. She is a researcher. She's a teacher. She has to constantly update herself and improvise as per the need of the situation. Before we go on to the next panelist, I would just like to inform all the participants that you can post your questions on Zoom if you've joined on Zoom, or on YouTube. All these questions will be taken at the end of the panel discussion. We now go on to the second speaker, and she is Dr. Lakshmi Menon, a very eminent academician, has been teaching the postgraduate students for the past so many years. We will invite Lakshmi to tell us what it is to be an academician, what is this, to study further, and how that improves your scope as a nutritionist in the academic field.
Thank you so much, Amrita ma'am. Am I audible? All right, great. I think it's a little difficult to sell my job after Purvi ma'am has made clinical dietitian sound so lovely. I'm wondering why I took up this career, but I'm not going to backtrack. Yeah. Thank you very much for the introduction, Amrita ma'am. And I think there's not one person in this Zoom call or YouTube videos who's going to disagree with me that you've always had one teacher in your life who's made an impact. Okay, it could have been somebody from KG to PG, but there's been one person or two people, and that's precisely what got me into this field. I'm not going to name one or two, it would not do justice, but the multiple teachers that came my way have influenced the choice of career that I took up. And I'm sure I have students amidst us who've also had such influences. So being an academician, please remember, it is not a static job. It is no longer rather a static job. It's no longer something that you're going to restrict yourselves to just textbooks, one textbook for a course. As ma'am has just mentioned now, nutrition is fast changing, it's dynamic. And as dynamic as it seems, the academic profession is also equally changing. And I'd like to think of it that when each one of us, especially in higher education institutions, when we choose academics as a career choice, we tend to be facilitators rather than the know-it-alls. So do not be overwhelmed, each one of you, when you think that, oh, how much do I know? Am I ready to face this academic challenge? There is never a day where I feel when I step into a class, have I still got a notch of, doubt in my mind? And I'm sure that is what keeps us going. So I started my career as a fresh out of college master's postgraduate student, looking out for a job as everyone did. And I had the opportunity to work at my alma mater. So I had done my UGC NET in home science, which is the stream that each one of us would probably take if you're especially a postgraduate in food science, nutrition, clinical nutrition, dietetics, etc. And I had done that in my final year of master's. So you're eligible to take up a UGC NET exam, as well as if you're looking at a state-bound exam, the SET or the SLET exams. In Maharashtra, for example, the University of Pune conducts it. Eligible to take that, and it may not be an easy exam. It's just like any of the other professional exams. So one chance, twice, you can attempt the exam, and I was lucky to complete the exam. I did apply only for a lecturership job, as I was not very keen on research at that point in my life. But probably for those of you who have an interest in research, you can also choose for a lecturership come a research fellow UGC examination. And once I cleared it, I entered my alma mater, and I had an opportunity to teach both the undergraduate and the postgraduate students. Of course, the postgraduate teaching assignments were very limited, but the undergraduate teaching, that is students of BSc, that teaching literally shapes the way you reinforce concepts that you've learned. You learn to present these concepts in more innovative manners. And let me tell you, it is literally a revision every single day that you step into a class. Okay. And that is one thing that I think that was the one point when I realized how much work goes into a teacher coming in and standing there for 40 minutes, how much effort it takes, and how you have 40 pairs of eyes. You're literally looking you down. Okay. And then you're wondering what the next question is going to be. But I'm sure that's the thrill and that's the pleasure that gets any academician going when you step into a class, however small or big it might be. I had the choice of working in Chennai. And then when I came to Mumbai, teaching was still my passion. I have never really thought of industry as a career. And that is when there was a flexibility of looking at part-time working assignments. So from a full-time career, I was newly married, new city. There's the stress that goes on. And I was also doing my PhD. So I was in the last phase of writing my thesis. And luckily, there was the opportunity. I got to meet some very nice people like Dr. Rupali, Dr. Gugre, and Nirmala Niketan College, who gave me assignments, clock hour based assignments. So that's another advantage of being an academician, where you can look at, if let's say at some point family is a priority, which it should be, I'm sure you can look at part-time assignments as well. And I did that for a few years before I was offered the opportunity to work in the postgraduate department. Now, this is just the teaching line of it. Now, remember, teaching does not restrict you to just going into a class, standing there, putting your PPT on, or logging into a Google Meet. No, none of that. Remember, you still can be an avid researcher. You can still be a student, okay? If your institutions like mine helps you or supports you with research grants, consultancies, which are small assignments that based on your professional skills, they help you to take up small assignments with organizations, NGOs, as ma'am said. You're still, you're still open to other multiple revenue streams as well. So if your core line of work is academics, beyond the call of your duty, you can still look at other opportunities such as this. If you like writing, for example, like I did look at doing a few technical writing courses. So I have still not got myself down to writing social media posts, but through NSI, yes, I have had an opportunity to try a few things here and there, still working on it. So as I'm telling you, teaching as a career has multiple portals. And somewhere down the line, I feel that you should not just think of it as a work-life balance career choice, but rather a life-work balance career choice as well. So you think of both of it, and think of also the impact that you leave on young minds who will probably at some point in their lives think back to those one or two lessons, as Purbi ma'am was saying. If you got your basics strong, there is nobody in the world who can stop you from saying that your diet is wrong. So you're getting your basics right from your teachers. And if you are that one person who's giving those basics, then that is precisely what I'm looking forward to in my career forth. So I hope I've delivered my point across, and I'm really happy to take up questions at the end of the session. Thank you so much, Amrita ma'am.
Thank you, Dr. Lakshmi. And I think it must be very clear to students now what they are supposed to do after their masters. If they are graduates, they have to do their masters, they have to do the UGC NET, they have to go in. If they want to do research, they can use the, to appear for the JRF. And that teaching, I will empathize with every word that Dr. Lakshmi has said, because I teach, I've been teaching for so many years. I know that the classroom has always and will always be a very dynamic and a very challenging space. So for a teacher, it does not stop with her education. It continues lifelong, because the students challenge her to keep learning and keep updating herself, keep communicating that to the students, and also making them start thinking about what they are learning and not just be passive receivers of information. So thank you very much, Dr. Lakshmi. The next few panelists are people who have taken a rather brave path. They have charted out a course for themselves and started their own organizations. So now I'll invite Shreya Adha. She is an entrepreneur. She has her own setup. Instead of me saying something about it, I would like Shreya to talk to us about her journey. Tell us what is it that brought her to not going in for the traditional job and having her own setup. So welcome,
Okay.
Shreya.
Thank you so much, Amrita ma'am. Thank you, NSI Mumbai chapter, and Anuradha ma'am for having me in today's panel discussion. To just give you an idea about regarding my journey. So when I started in 2012, after my bachelor's in nutrition and dietetics, there was honestly only 2 colleges in Maharashtra which was providing sports nutrition course, and out of which Nirmala Niketan was the only one which had master's 2 years complete degree in the same. So I opted for that. My journey started from that. And one thing which I would like to tell all of the youngsters over here is, it's okay if your path or your passion is still not explored or you're not sure about it. Because when I passed out, when I started working, that's when I got to know that, oh, sports nutrition is something that I want to go for, right? So it's okay. I mean, take your own time, understand what you're interested in. And when I studied also, there was a lot of information. It was completely a new topic. There was not much of an awareness that was there at that point of time as compared to what we are today at. So it was, I would not say it was a struggle, but yes, there was a lot of that hunger to learn more, to explore more, to connect more with the people, right? So after I passed out, I was working for someone for almost 4.5 years, and there was a good amount of experience that I got, because I happened to get a lot of Olympic players. And in sports, fortunately, you have such a broad area, because it's not that you'll get only a swimmer or you'll get only a marathon runner. There are wide varieties of athletes that you can come across to. And the most challenging part, or the most fun part, I would say, about the work is that the nutrition for each athlete is not the same, even if they are in the same sport. So even if they're in the same sport, their body composition, their age, the kind of diet that they follow, the kind of training that they do, everything is different. And you as a sports nutritionist need to be updated, need to be exploring more, need to know the basics of, like how Purbi ma'am and Lakshmi ma'am also mentioned, you need to know the basics about the sport. And one of the things that I always encourage, my team is also here today, all the interns that we have, is to start yourself or start your own journey of being into some or the other sport. Because when I passed out and when I started working also, I was not really in school. Yeah, definitely I was a volleyball player, but then that was only limited to school and college. But later on, the moment I got into the career or the job or the role that I was doing, I started knowing, or I started exploring, that it's important for me to understand some of the aspects that my clients are trying to tell me. And that's when I was like, okay, can I get into a sport? So let's figure out whether should I be an endurance athlete or whether should I be a power athlete. And I tried both of them. And I myself then started exploring and understanding that, okay, probably I'm more of a power athlete as compared to an endurance athlete, but provided saying that, yes, there is a scope for me to be an endurance sport as well. So today I'm pretty proud to say that I'm a runner as well as I've tried powerlifting. So when I have started knowing this about myself and how my body is actually reacting to this, it becomes very much easy for me to empathize with the information that my client is sharing with me. Right. So yes, after working for so many years, it was never a plan. Honestly, it was never a plan. I was a very average student. Most of my professors are here, so they would agree to it. It was never a plan that I would start with my own clinic. But yes, definitely more of like, destiny, guided me to do the same. I started with my own clinic. It was altogether a new experience, lot of struggle, which is still there, and a lot of, I would say hard work and perseverance that, you have to every day wake up and keep doing what you're doing, has led me to where I am. So today, proudly, I'm into sports. We are dealing with some of the top athletes of the country. Our major forte is into grassroots level athletes. So I love working with kid athletes, because you can gel up well, you can, start working on their basics, make them understand. So I have players who've been with me for 4 to 5 years now. I've seen them grow. I've seen them perform well, improve their performance, or improve the kind of sport that they are into. And nowadays, it's not only about the nutrition guidelines or the nutrition suggestions that I'm giving them or planning diets for them, but it's more like, they come up to me and they're like, ma'am, this is what is happening in my life. So can you guide me regarding the same? So I think that is one of the biggest achievements that, that makes you connect with the athlete. Apart from that, what I have seen in most of the sports nutritionists that are in the country is, over the period of time, I'm not saying it's not possible, but eventually it happens that you have to probably, or you get into only specializing in one sport. Like I said, we have a lot of squash players with us, so we have major of the work that is happening in that area, but that doesn't mean that we are not into other sports, right? So you still have more scope working in all the sports. Talking about job opportunities, when I started, there was nothing. Now, Sports Authority of India has taken a brilliant initiative. In every state, there are 4 to 5 at least, or minimum 2 size centers, which is making sure that there is a sports nutritionist on board. So slowly and gradually, the sports science culture that is being implemented or that is being used globally or internationally is also coming to India. So as a sports nutritionist, it's not only your job to work on the nutrition, but work as a team. Because whenever you're working with an athlete, it's not the nutrition part, but it's their physiology, or maybe it's a physiologist who's associated with them, the psychologist, the physiotherapist, the strength and conditioning coach, the coach, the sports coach. All of you work as a team. So it's not only that your role is to work on the nutrition or the diet planning part, but yes, definitely to work in sync with all of these people, take their inputs and work or use those strategies to improving your athlete's life. So that is one thing. So Sports Authority of India or any government organizations have come up with a lot of opportunities. Even NSI, NIS Patiala, sorry, not NSI, NIS Patiala has job openings for sports nutritionists who have done courses. There are good amount of colleges now. There are, because we get a lot of resumes for internships and jobs. So in Chandigarh, in Northeast, South India, Mumbai, or other cities, even Rajasthan for that matter, has good amount of colleges who are providing with sports nutrition course. So that is one line of area where you can explore with regards to the jobs that you can go into. Apart from that, there are foundations. So all of these private or government foundations actually have programs which are run for the athletes, and they are well funded to the athletes, and the athletes have actually told to make sure that they have all the team or all the experts on board. So that's when you can also come into a picture. You can also associate with foundations. So when we talk about my clinic also, so we are associated with Go Sports Foundation, that actually takes care of all the elite players of India. So that is one area. Even Abhinav Bindra Foundation, there is Prakash Padukone Foundation. So all of these places actually have better prospects when it comes to the job opportunities. Apart from that, one thing, for whether you are a clinical dietitian, or a sports nutritionist, or a public health in that particular sector, one important thing which I would like to tell all the young nutritionists is try and connect with more and more people, because that will help you in the long run. When I started, there was very few people that I was connected with, but now this one important quality that I have is actually helping me explore and plus reach out to more and more people. Because what we try and do is, whenever we are in a setup, we try and restrict ourselves that, okay, we need to know only these many people. But if you go above and beyond that area of expertise, definitely there will be a scope for you to learn, the scope for you to meet those people in person and try and understand what they're doing. So that is one area which I would like to tell all of the youngsters to start working on. Because see, in our time, there was no social media, so it was very difficult to reach out to people. But you do have that privilege of reaching out and connecting with more and more people. Apart from that, there are NGOs in the sports nutrition industries as well. So that can be one of the expert areas. I never thought that I could be a thesis guide to students, or I would be providing internships. So we are also in that area. We are associated with SVT Juhu College as well as Nirmala Niketan. So we have interns coming in every year to have an hands-on experience with regards to the practical scenario of sports nutrition. Because honestly speaking, what is being taught in the college with regards to sports nutrition is totally different when you step out of the college. So it's very important for you to understand and get that experience before you actually start working. So it's a good area that our clinic actually is working into. Apart from that, I've also had an opportunity to educate sports management students. Because sports management, they work on various aspects, but eventually when they are working with the team or when they are traveling with the team, they need to know that how and when and why sports nutrition is an important part of an athlete's life. And I would say the brighter side or the cherry on the cake when it comes to sports nutrition is working with teams. Be it IPL, be it Pro Kabaddi League, be it Volleyball League, be it WPL now, Women's Premier League. You can definitely be associated with the team. You get to travel with the team. You get to, explore, work with different types of athletes, even though they are in the same sport. But the real challenge here comes in that, even if the athletes are in the same sport, the positioning of the athlete is totally different, and so does the nutrition. So you cannot give the same nutrition for a bowler versus for a batsman. Just giving an idea. right? So that is one of the, I would say, lamplight of being in the sports nutrition area as well, wherein you get to learn more, travel with the teams, and apart from that, I think there are a lot more, I would say, grassroots level academies, institutes, gymkhanas, who are working on these athletes, who are actually having all the aspects of the sports science on board, or all the experts of sports science on board, to start the entire process of performance enhancement in an athlete's life from the time they've actually started with the sports career. So these are also some of the areas that the nutritionist can be associated with, especially when she has her own setup. The only drawback, I would say, is when you are working with an organization, or maybe say with Sports Authority of India, there can be certain liabilities or certain parameters that you might not be allowed to do your own work. But yes, if you have your own setup, like how I have mine, like Purvi ma'am said, sky is the limit. Like you can be on every possible profession, every possible opportunity that you can get, you can be a part of the same, and you can excel in the same, because I never thought that I would be handling so many responsibilities at one point of time. So that's just a bit from my end with regards to how and what all you can do in sports nutrition. Is definitely one of the most exciting careers when we talk about nutrition. You get to learn more. I am associated with a lot of international experts as well. So you get to be a part of those organizations and institutes. You get to learn more. Another thing, last point I would like to tell all the youngsters is start listening to podcasts. We never had it during our time, but we are getting into the zone of it, because podcast is the most easiest way to learn in small bits, and the kind of information that you get out of it is just brilliant. So these are some of the bits. So instead of scrolling more and more reels, it's best that you can just invest 1 hour of your daily time to start learning. Because like Purvi ma'am and Lakshmi ma'am also said, like there is no limit for you to learn, and you should be keep on upgrading yourself. And similar case is not only in clinical nutrition, but yes, definitely in sports nutrition. You cannot have similar strategy working for every athlete of yours. You need to keep on learning more, exploring more, reading more research articles, because there is unfortunately there's very limited research with the Indian athletes. So you yourself has to be that expert, and that is also one of the reasons when I said initially that you should start being into some or the other sport, because you would not know what the client is saying. If he says, if he tells you that I have got so and so injury, you would not know about it. So work on your basic work on the small aspect that surrounds around athlete's life, and then get into the profession. So thank you so much.
Thank you very much, Shreya. That was indeed a very spirited, enthusing conversation, I think, that you had with the girls. And I'm sure, just like I am enthused, a lot of these participants will be definitely looking at this as a career option. And they must understand that once you are going into sports nutrition, it is a field which requires your basics to be in place. It requires your application to be very meticulous, very customized, and you should be willing to learn with every passing day. So thank you very much, Shreya. So now we have the next entrepreneur on board today, our panel, that is Kajal Bhatia. She is the founder of Plant Power, and we would like Kajal to also share her life journey with us. Tell us how she has reached where she has reached, so that our girls get another option which they can explore. Welcome, Kajal.
Thank you, Amrita ma'am. Hi, everyone. I hope I'm audible. Actually, I'm on a phone and I'm speaking from my sister's home. The troubles related to technology when you're somewhere else, right? So I just hope, everybody else can hear me clearly. My journey is pretty interesting even to me today. Sometimes I have to pinch myself that what am I doing? How did I land up doing what I'm doing today? And well, when I look back in retrospect, I can definitely join the dots. And those dots are the milestones that come across in every life. And I would like you to all consider and take every opportunity as a milestone, to be honest, because that's what's got me there today. To just give a brief introduction, my name is Kajal Bhatia, and I'm the founder of Plant Power. The name is incidental to the kind of nutrition that I advocate. My journey as a nutritionist has been pretty interesting because earlier I was an economics graduate. Before I got married, I had the opportunity and the gratitude and a pure miracle to meet some amazing mentors in my life. Post my marriage, actually, Anu ma'am is one of them on this panel, and thank you for inviting me here again, Anu ma'am. Mala ma'am from Dr. BMN College. So I actually was knocking many university doors. It was an incident that was very personal to me, happened in my own family where, just post my marriage, there were some clinical situations that had come up, and I was quite intrigued to understand a little bit more about health. I definitely didn't want to follow the regular path, and my family business was already in distribution of food industry. So my husband was like, don't ask me too many questions about what goes behind a product. If you want to know something, then go and study, because that's a pure luxury and opportunity. So I had a 6-year-old at the time, and I remember knocking many universities' doors. Long story short, there were many that had rejected me purely because of my age at the time. I was 35, if I'm not mistaken, with a child, and many people felt I was not serious enough. And of course, I was following a very organic route rather than saying, hey, I want a job. I didn't have any answers. I just said, I want to learn more about health to people that I was talking to. Anyways, Dr. BMN College opened up its gates for me, and I went through the entire process of 4 years of learning with them, sat with students just like you all participants, half my age, but thoroughly enjoyed the process morning to night, because yes, I had the commitment to learn. I think that changes a lot. I hear Shreya, if I'm not mistaken, earlier shared that, at school, many students are not bright. And yes, in my earlier economics career, it was the same for me. I was not a very bright student. But when the commitment changed for me that, hey, I wanted to know more, I got the drive and I said, I have to learn what I'm here for. And that's where my journey began as a nutritionist. Moving on, I finished my education, did my diabetes education also. And of course, in the process, helped my family members with what they were suffering or going through. And then organically, people started knocking at my door at home, saying, hey, Kajal, we would like to do consultations with you. And these were like prestigious corporates. And I was taken aback a little, but I said, what? It gives me the opportunity and the experience. Let me never not say no. I will learn. And that's where I started, from my home, in a small area of my house where even MDs and directors would come in. One of them was a Boston Consulting Group member. It's a Fortune 500 company. And he became a mentor to me, and he said, Kajal, what you're working with, it's amazing, because I was specializing in plant-based nutrition 20 years ago. I had the experience of meeting someone overseas who showed this path to me, and it worked for me. And I said, hey, this is something I believe in, even though it is different for the rest. Let me see how much I can learn and how much I can share to the world. So became a nutritionist, went through a couple of corporates, BCG for one, Google India also took me up, Raw Pressery, which is a cold pressed juice company. They also started believing in plant-based nutrition. In fact, Anuj, the founder, he was very keen to take it, everywhere in India. And he said, Kajal, people don't understand cold pressed juices. So here I want to share that before I became an entrepreneur, I did have the experience of working with somebody else who was into products. Okay. Currently, I have my own brand, and I do help other brands also. But I did have the experience of working with someone, and that's where I realized the opportunity that exists in India. I mean, it's a population that's 1 billion plus, the middle class especially, and the age group, that is, the younger age group, is pretty significant for us to ignore, actually. So many people, when I was consulting at Raw Pressery, as a nutritionist, they would share that, Kajal, there are many products out there, and you are a nutritionist, we understand, but how do we trust? We trust nutritionists. And I remember going back to Anu ma'am at the time and sharing that, ma'am, why is it that we as nutritionists are not able to make products? Why is it that, we can be a part of the pie? Why is it that we are always following somebody else who's coming up with a product, or an FMCG, which is a fast moving consumer industry? It's called FMCG goods, which is the popular brands like Britannia, Parley, all of them come out with amazing products, and they write health claims on it. And we as nutritionists also can do the same. And that was where my, in fact, commitment for entering this industry started. I was skeptical. I must share. I was very nervous in spite of having a family business. But at the same time, I knew that this is what needed to happen for many more people to trust that as a nutritionist, yes, we do write diet plans, but even when encouraging others who are on the go to take some product that is available, sometimes we are not 100% sure. And nobody was ready to take up my ideas at that time. Hey, let's come up with plant-based yogurt, plant-based meat, because it was very new. It was a niche. So 4.5 years ago, I started the brand Plant Power. And the brand offers snacks that are 100% plant-based. But of course, I'm a Gujarati, so I brought the taste aspect very, very strongly, because I still do believe that if healthy products are not tasty, they're not sustainable for everyone, including me. If I'm on a diet plan with any of, the best of the nutritionists out there, I would definitely want something that leaves a sensory of taste in my mouth. And, just maybe because of the background and everything that I created, I started working on product development. And one by one, brought a whole range of snacks, brought a whole range of shakes, because my son by then was quite old enough. And I used to see that in schools, they were giving a lot of products that were not really something that a nutritionist would appreciate or recommend. So at home, I started making these energy bars. They were called 80/20 then. And we had the opportunity to, this was in 2019. I remember we had the opportunity to get it not only across stores in India. I'm sure Anu ma'am remembers, I was overjoyed, when the product worked in the market. We went to Jet Airways, we were exporting in the first year. And yes, of course, the larger brands were out there, but I was not intimidated. I said, you know what, there's place for everyone. And I still believe the same, even for people, the students here who are aspiring to get into the food industry. There's always a buyer, especially in today's market. There is a buyer for everyone. Of course, there are a few do's and don'ts that I'll share with you at the end of the session. But coming back to the point, that yes, I did start out with the brand. And one of the biggest issues that most of the entrepreneurs face, and I have faced every single day, is uncertainty. I was not prepared for it. The lockdown happened, Jet Airways shut down. We were actually thinking, whether we want to continue the business. But I knew that the products had an appeal in the market. We should survive the lockdown, and that's what we did. We bootstrapped the company. The company's from 80/20, it became plantpower.fit. And today we are back in the market again. And we are available at multiple stores. We are at JW Marriott. We are getting onto Vistara Airlines, et cetera, et cetera, et cetera. Now, coming back to, the fact that can every nutritionist be an entrepreneur? Yes, of course, if you want it. It is not important that every nutritionist has to make product, but they can also help someone create a product, right? Especially today is the golden age. The sentiment is very high. The government has, incubated so many startups. Millet, this is the year of the millet. for all. It's the International Year of the Millet, and the government is doing so much to encourage and foster community of millet entrepreneurs. So there are ways in which one can start, but I must share right up, and I know I have a short time, but 10 years. 10 years you have to be committed if you're going to start a company in food, either as an entrepreneur or even as a career, because I wouldn't say today it's all about competition. Today it's more about co-creation, but I would definitely say that because the segment has become so popular, there is a huge surplus in the market. All right. So when you're trying to come out with something, do something that you believe in. I remember Shreya saying that when she's talking to other athletes, she herself had to run. Okay. But yes, do have a differentiator that you believe in, that you feel others can also believe in. Have mentors all the way, whether through your successes, through your failures. There are so many times that I have bothered my faculty, my teachers at odd hours in the night sometimes, etc. Right? Also, the fact that I did mention about the 10 years, I think one of the panelists mentioned the importance of a community, or staying in touch with others, or developing a network. I think this is the most critical aspect. I myself am very social media shy. You can guess my age, considering I started my career 15 years ago as a nutritionist when I was 35. But so I'm still social media shy, but that has been a mistake, to be honest, because in today's age, one needs to learn technology, and it is possible. Chat GPT, I hear again, somebody mentioned podcasts, how to do Amazon sales. It's all possible from the desk of your home. The only difference is, and sometimes it's an issue, is when people say, oh, you're a home chef, or, oh, you must be doing it from your home. Not necessary. You can think big if you want. I work out of a proper unit. I have a qualified team. My technologists are from ICT college. So it did take time to set it up, but you have to think professional if you are thinking of making a career out of this. There is a lot of opportunity. We do take on interns all the time from multiple colleges, and even from food technology institutes. I do welcome students who want to be able to learn better with us. At the same time, please remember that we nutritionists are for each other. In today's times, we need each other to support each other's ventures, campaigns, thought processes, etc. There is no competition. It is only co-creation. So with that, I wish you the best. And again, I thank all of you and NSI for having me on board. Sorry if I've stepped over my time, but my story has been much bigger than this. I just didn't have time enough to capsulate it.
Thank you for this very, very inspiring narration of your journey. Of course, spoken in 5 or 10 minutes, but definitely it must have been very, very challenging, and I'm sure very interesting also. I'm sure the girls understand after listening to Shreya and Kajal that an entrepreneur has to be persistent, she has to be confident, she has to be optimistic, and she has to believe in her idea. So thank you very much, Kajal, for sharing your thoughts. And now I will invite Mrs. Neha Arora. She is a public health nutritionist. This is also a career option which a lot of students, will find interest in. Would be their interest, which they wouldn't have understood when they were pursuing academics. That there are these some subjects in which you seem to be doing more. You seem to be more interested, seem to be doing better. So who better than Neha to share her thoughts with us? Welcome, Neha.
Hello, thank you for inviting me. So I'll start a little bit by sharing my career journey. Okay. So I started actually as a clinical nutritionist because when I did my postgrad, I wasn't really I didn't have anybody who guided me to do public health at that point of time. There was the opportunity that time was presented to me was either to work as in fitness industry or in corporate and on clinical. So that time I had done couple of internships, and I had sort of felt that clinical is something what I would have more better forte in, and something I was quite interested. But it was only when I decided to pursue my master's, which I pursued from University of Bristol, which is in Southwest England. And that time I took up a course which was called MSc in Nutrition, Physical Activity and Public Health. And that's where I actually got very much interested in the public health aspect of nutrition. And once I completed that course, and the public health system which I got exposed to while studying and working in UK, when I came back to India, I knew that I didn't want to go back to clinical, and then I started exploring opportunities in public health in India. And that time I actually, some of you might know, I met Ratna Thar ma'am. She is one of the professors in Nirmala Niketan, and she introduced me to this organization which was working on maternal child health programs and was looking for nutritionists. They were that time looking for someone part-time to come and help them at the clinic. But while I used to go and mostly do volunteering clinic, I also started working on a project in Tata Institute of Social Sciences, which had coincidentally Dr. Kasturi Senre join as an adjunct professor, and she was starting the community nutrition department in TIS. And through those two experiences, I entered the field of public health nutrition. And then with my TIS experience, and while I was at the organization, they were looking at having someone join more of a senior managerial role, who would not only look at the clinics that were being run for the vulnerable population, the children and the women, but they were also wanting to expand their nutrition program. And that's how I started working with them. And through that organization, I got exposed to bigger organizations. So where I was working was more like a local NGO, but I got exposed to international organizations like UNICEF, Action Against Hunger. I also got exposed to government organizations, and especially when I got exposed to Action Against Hunger. This is an organization which is a French organization, and they generally not like most of international organizations, you will see they look for people from medical degree, but this was an organization that they had managers in nurse who had come from nursing background, from nutrition background. And so when I joined Action Against Hunger, my co-colleagues were someone who had actually come from MSW background. And there, that was where I realized that the nutrition career for nutrition in public health is not limited to just being a nutritionist in the community or giving just talks or education, but it is far much more. So there I learned that nutrition can be part of assessments, supporting the bigger assessments. In fact, Action Against Hunger is an organization which has a lot of works on a lot of nutrition assessment methodologies, which they train globally to different organizations also. And there are people who have just expertised themselves in that. Then I also learned that there was scope for nutrition in monitoring and evaluation part of it. In fact, in my current organization, we have a special unit for monitoring and evaluation. And I know a lot of nutritionists who have now working at higher level in just M&E part of it. I personally moved my career mostly into program management and technical advisory. So after working with the local organization, I worked with Action Against Hunger. Then I worked with couple other organizations, supporting them in developing their protocols, supporting them with proposal writing, with donor engagements, getting their systems in place. Then I worked also as a nutritionist, as a state health and nutritionist for government of Maharashtra in the Integrated Child Development Schemes Department. And then for 2 years ago, I joined Nutrition International. And Nutrition International purely works on nutrition programs, as its name suggests. It works on maternal child health nutrition. They were working for many years on micronutrient. This is a Canadian-based organization which has a place in Africa, has a lot of their teams in Africa as well as in Asia. And so we work over here on maternal child health nutrition, adolescent nutrition, and I have recently started working on fortification, since this is one of the strategies that not only globally has given a lot of wide acceptance, but also in India. A few years ago, the Prime Minister had announced that he wanted fortified rice to be given in through all supplementary nutrition programs. So here we are supporting the government of Gujarat, where I am currently based, in implementing the fortification strategy of GOI, and so there is again a growth I would see in fortification programs, and then within fortification you have quality control that you can be part of. You have the whole program management. Another aspect that I have seen nutrition grow in my public health uh, system was SBCC. So you have behavior change communication campaigns, again your IEC materials that are being prepared, where nutritionists are involved to develop such materials, and trainings and capacity buildings. So there is not, there are, like, I can see multiple verticals that where you can grow and expertise yourself in. And also there are some who have grown, nutritionists I know, who have grown in leadership positions within these international organizations. And I know quite a few nutritionists who came from pure nutrition backgrounds and who are now the country directors. And there have been people who have gone beyond being country directors. There are people who are now in regional. There's Dr. Vani Sethi, who's in Nepal and Southeast Asia in UNICEF. Then I know of another doctor, another nutritionist who was once upon a time. I know a couple of nutritionists, in fact, who are right now working in the HQ of UNICEF in New York office. So there is, in terms of growth, I've seen a lot of growth for nutritionists in public health. And there's a lot of I would say satisfaction also you get in your job when you work, be it whether you're working with a local organization or with one of the international organizations or with the government, because you will see a lot of change happening. Definitely, you will have beneficiaries coming back and sharing the experiences, or you will see systems becoming better and growing well. So that's a little bit about. So I just joined very organically this and one of the things, a lot of things what you all said is true, which falls back to public health nutrition. It is also that you never stop learning. Okay, you have to keep updating yourself, especially like if you have some interest where you want to grow. Like for me personally, I'm quite interested in learning how to document my programs better so that it can be shared very well. So updating your writing skills. Then if you are interested in doing the monitoring and evaluation part, then you can update your data understanding or analyzing skills. If you are quite, you want to stick to the technical part, so you will have to keep developing your skills on the different technical and like just advances as well, and participating in the conferences, not blindly, but looking at conferences which give you the additional education points, rather, who are being recognized through a university, or rather than just going for conferences which are sponsored by different brands. So things like that, where you will have to keep updating yourself. You have to keep a very open mind. One thing that in public health you have, if you really want to grow, you have to love to travel, because you will be going to field a lot. You have to be flexible, because everywhere you will not have opportunities of having luxury in terms. You should be okay to live and board and lodge in places which may not have good hotels and stay facilities as such. So I would say this is a job for someone who is definitely more flexible in personality. I'll be happy to answer any questions that people will have. I'll stop my story here.
Thank you, Neha. And I'm sure the girls have understood that the sky is the limit if you're a graduate in nutrition and dietetics, and also if you've done public health nutrition. Thank you for telling us the kind of progress that these girls can, depending on the kind of commitment and application that they display through their career. Thank you so much, Neha. And now we have with us Bansri Rao. She is the founder of the Nutrition Insights magazine. I think as nutritionists, what we are lacking is the ability to, publicize ourselves, put the knowledge out there. We have all the information. Bansri has taken that route of making sure that, we put out validated, reliable nutrition content out there. So Bansri, can you please share your journey with us?
Hello, everyone. Thank you, Amrita ma'am. Thank you, NSI Mumbai, for giving me this opportunity. I am really glad right now sitting here when I've actually got a chance to speak in front of all the mentors here. Like every panelist here sitting is one of my mentor at some point here. So thank you very much for giving this opportunity to me. And as rightly Amrita ma'am said, that right now when we were listening to each of the panelist member here, we saw that all the nutritionists are doing a lot of work in a lot of different fields. So we have been working, we have been doing a lot of things, but we have never got an opportunity to showcase our work. Everywhere we have been working, but our work, what we have been doing, have been hidden somewhere down the line, which has not come out in front of people, and understanding that yes, nutrition plays a very important role. So that is where Nutrition Insight magazine is one of the initiatives which I have taken, where we've come out with a magazine which is purely based on nutrition. So you must have heard there are a lot of magazines which are on food, which are on fitness, nutraceuticals also. But there is not a magazine where we can talk only purely about nutrition. So that is what is the motto of our magazine, which is going to talk purely about nutrition. And when I say we talk purely about nutrition, that is where I would like to discuss a career opportunity for each of the student or each of the participant here, which is about content writing. We hear a lot of people writing articles. We hear of people writing a lot on social media platforms which are available. So that is where content writing comes into picture. So content writing is one of the career opportunity for nutritionists and a very good opportunity for us, because we coming with a background with nutrition, we become the right person to write about nutrition. There are a lot of people who are talking about nutrition. There are a lot of people who are writing a lot of articles about nutrition, but we do not know what is their qualification, how scientifically backed are those articles. So that is where we as nutritionists, when we come into content writing, we make it sure that the articles what we are writing are researchally backed, are scientifically right, and it is appropriate for the reader to consume it. When you are writing an article, it is there the tendency that the consumer or the reader is going to apply somewhere into their daily life. So we cannot put forth anything which is not scientifically backed or which is not researchly backed. So that is where it becomes very important for nutritionists to come into content writing. And these days, as Shreya ma'am, Kajal ma'am, they had just recently mentioned that podcast is something which is coming through a lot now. People are coming onto podcast platform a lot. People are talking a lot on podcast. So when a nutritionist, when a qualified person is coming and talking, it becomes much more easier for people to follow into their daily lives. So it becomes very important that social media is being used in a right manner. Recently, government has also passed a bill saying that all the wellness professionals who are there on social media are supposed to display their qualification. So that is one of the very good initiative which government has taken, and that makes it more, what would you say, that makes it more authenticated for the people to go to right person and to listen to right person. So as we saw, there are different fields: clinical nutrition, sports nutrition, public health nutrition, research nutrition, academics. Each field what we are talking here is going to come into the one big circle of content writing. Each field, be it clinical nutrition, at the other point you have to document it. Be it public health nutrition, right now Neha ma'am said that she has to work on her writing skills where she has to document it. So here I would suggest taking up some writing courses or some skill-based courses during your master's degree or bachelor's degree would help you in writing your content. And when you are a nutritionist in today's time, social media is something which goes without saying. You cannot just sit in your clinic and keep consulting to your patient. After COVID, teleconsultation has become very important, where you have to be socially backed with all the knowledge and you have to also be socially active. So that is where social media comes into picture, and that is where we all have to start learning how efficiently we can use social media. So being a nutritionist, you are not abide to only become a clinical nutritionist, a sports nutritionist, a public health nutritionist. You can be everywhere, but being that you have your knowledge best at your what you can provide to the people. Because when I say that you are going and talking on a social media, you are not going to go and talk to one person, but you are going to talk to a mass of media there. There is a mass of people to whom you are going to address, and that is where it becomes your responsibility that you have to be scientifically right. You cannot just go and pass any statement. So being educated, reading every day, that is what every panelist has been saying, that every day is new, every day you have to keep updating yourself. So being a content writer also, it becomes very important that you are updating your knowledge every single day. Every day there is something new happening, every day there is some new research coming out. Applying that research is what are happening in every day. To apply it in your own practice is what is your duty. So make it a point that everyone, whenever we are coming into a professional life, the books what we have closed in our in our bachelor's or in a master's degree, do not close it and keep it in your cupboards, but make it a point that you open your books and keep reading every day. So that is what I would like to say. So thank you so much. I would be more than happy to attend any questions which I can. Thank you.
Thank you very much, Bansiri, for being very brief, but very, very, very clear and very effective in telling us why it is important for nutritionists to be in content writing. Why it is important that we are more forthright in putting the nutrition information in the public space. And if all our participants on Zoom or YouTube are listening to us very carefully, they would have understood that research is the common thread. It is something which we cannot overlook. It is something which we may consciously or unconsciously be doing in small matters, and some of us take up research as a formal profession, or it could just be that I go in for a qualification in research. So we have with us a very, very experienced person in the field of nutrition research, that is Dr. Neha Sanvalka. She's going to tell us what is the scope in research as far as nutrition is concerned.
Thank you so much, Amrita. Actually, all the entire panelists before me have made my job simpler. So when we were discussing about the flow of today's panel discussions, I actually called Amrita and told me, Amrita, please keep me at last so that before, if everybody else talks, I'm pretty sure they'll be covering research in some part or the other. So keep me at last so that I don't have to tell the importance of research, because right from Purvi to Bansiri, everyone has talked about research. So that's how important research is a part of nutrition fraternity. When I go and teach my students, students always tell me the first thing, ma'am, humko research क्यों करना है? ये subject ही क्यों है? So I tell them that when you go and work as a clinical dietitian also, the biggest clinical dietitians I know of in Mumbai city, okay, I'll talk in Mumbai because of course I am based out of Mumbai. I can say the biggest clinical dietitians all across India or the world over are involved in research. Research के बिना हम आगे नहीं बढ़ सकते हैं. And as you know, Purvi said or Shreya said or others reported, we have been practicing majorly based on guidelines which have been given by American or Australian associations. We have very less Indian data as far as nutrition goes. So I'm sure that, Purvi said, Shreya said that now we are getting slowly this Indian data, and that is where, we can start applying things for Indians. See, we Indians have a very different body composition. The way our metabolism works is very different. So how can we apply the same nutritional guidelines which are meant for an Australian or an American or maybe an African who has a very different body composition? If we talk about Neha's field, I met Neha when we traveled for my first conference. We traveled together. I think not for the first conference, we went to Hyderabad for one of our conferences together, and that's where we traveled together. Through a friend, I got to know Neha. So, research, and even when she's working in child health and nutrition, research is absolutely a very important aspect of any field in nutrition. So to start about how I started my career in nutrition, it's a very surprising field. I would say that I did not even plan to pursue a master's degree. My entire plan was BSc karo, फिर PG diploma karo, and start practicing as a clinical nutritionist. That was my entire plan as far as my career was concerned when I was doing my bachelor's in dietetics. I did my bachelor's in dietetics from SVT College, and as a part of our bachelor's, we had a 6 weeks internship. And during my internship, I did it at Guru Nanak Hospital, and the kind of mentorship I got from Dr. Shweta Rastogi, who's the chief dietitian there, it kind of opened my world that no, PG diploma is not the end of it. I need to do a master's. And sadly, at that point of time, when I passed out in 2005, in Mumbai city, there was master's only in one college in India, in Bombay, in dietetics. Okay, I'm not talking about nutrition. Only Nirmala Niketan had MSc dietetics, nutrition and dietetics. And now we have many more colleges in Mumbai providing MSc dietetics. And I was very sure I want to do clinical dietetics. I did not want to do plain nutrition. So the closest city that my parents were okay with me going and studying was Pune. And I ended up at Interdisciplinary School of Health Sciences, Pune University, to do my master's. And in my first semester itself of master's, I got an opportunity to work as on a research at Jahangir Hospital, which I could take it up as my MSc project. And that's how my research journey started. But till the time I was doing my master also, my plan was master's kiya aur Bombay aa jao aur clinical dietetics practice karna hai humko. Well, I was so obsessed with working in a hospital setup, working with patients, because I'm sure how Purbi and Shreya and others, I love working with people, right? And I really wanted to make an impact on people's life. So till then also, I really had no plans of kind of, getting into research as a career. But then, life happens. Things happened, and then I ended up doing another project at Jahangir, and then we had a foreign collaborator, Dr. Zulf Mughal. And the second project which I took up at Jahangir, actually I was in a hospital for an ACL repair surgery, which is an anterior cruciate ligament repair surgery, after my second semester. And I was lying in the hospital after the surgery. On the day of surgery, Dr. Khadilkar sent me an email, who was my mentor, that there's a project we are doing. We want you to analyze the diet. We'll collect the data in hand because I know you've undergone a surgery. Will you do it? I'm like, yes, ma'am. मुझे तो hospital में रहना है 4 दिन. उसके बाद मैं घर पे भी जाके there is physio and everything, so I can't do anything. You send me the data, I'll analyze it and I'll send it to you. So Dr. Zulf Mughal, who was a foreign collaborator from UK, he said that she's so passionate about it. Why don't you do a PhD? And that's how my journey for, PhD started. After completing my PhD, when I came back to Bombay, Dr. Subhadra Mandalika, who is already also there in the webinar with us, she knew that my co-guide at PhD was a biostatistician, and I have done all my biostatistics by myself. So ma'am asked me if I would teach at Nirmala Niketan to some of the coursework on SPSS, which is a statistical software. So Subhadra ma'am provided me my first opportunity to teach SPSS. And then one of my professors at SVT, who also knew, I know statistics. So she told me, will I analyze data set for some of the students she was mentoring for MSc. So that's how my journey started in the field of nutrition research and biostatistics. Now, the one thing which of this, I don't know if you caught on to is, which a lot of my other panelists have said, communication and being in touch with others. So the reason why Subhadra ma'am or Ramaswamy ma'am asked me that if I could do this was because I used to keep in touch with mentors and teachers from other colleges, and they knew I have an experience in this field of work, right? So already when I was doing my PhD, I used to go as a visiting faculty to SVT already at that time, So I used to obviously, I used to attend a lot of conferences. That's where I met Dr. Subhadra. So you have to, it's very important that, you keep talking to people, you keep promoting yourself, and that's how people get to know you. And so once I started teaching, once I started giving consultations for biostatistics, it's been about 10 years now that I've been giving biostatistical consultations, and I have not looked back since then. We've conducted endless workshops for research and biostatistics. And I would say that my career was never planned. It's all about, grabbing onto opportunities, as Kajal said, that I have grabbed onto opportunities that life has given me. And I have held on to them and then went ahead and done it. And, it's very important that you keep in touch with your friends and colleagues, even at your master's level. So I'm currently a consultant biostatistician at Kokilaben Dhirubhai Ambani Hospital. How I ended up being a consultant at Kokilaben was because the chief dietitian at Kokilaben is my batchmate from both graduation and masters. Right? So when they were looking for somebody, I was already working on a project with her. So because I was already working on one of her projects, that's how the hospital like, okay, you're working on her project, please, we have this opening, please apply for it. And, it worked out for me. So that's how you kind of build an opportunity for yourself. And as Lakshmi ma'am said, your opportunities for teaching are not restricted to a particular institute. Like a lot of almost all participants and the panelists know that I teach as a visiting faculty at different colleges in Mumbai city. So I am an academician, but I am not restricted to one college because, as Lakshmi said, family is also important, right? So I know I cannot do a full-time job, but I keep in touch with the colleges, different colleges, and I tell them, this is a subject I am comfortable teaching. And if there's an option for a visiting faculty, and in my subject as a researcher or as a research methods in biostatistics, most colleges have visiting faculty to teach, right? So that's another opportunity into research that you all can explore. Many students come up with this nowadays that, how can we start our career into research and nutrition research? So one thing is, a lot of associations and international associations, names that Neha said, these associations have openings for nutritionists. So keep a lookout for opening for nutritionists in research position at these institutes. Also, keep a lookout for opening for research nutritionists at NIN or ICMR, because even NIN and ICMR have short-term projects, also not necessarily long-term. Keep in touch with your colleges, because nowadays a lot of colleges are doing collaborative projects with a lot of brands. Okay, so I do for respect of privacy of the institutes, I wouldn't be taking name. But I do know that currently also, at least even Bansari contacted me recently for one project, that one of the colleges is having project. Ma'am, do you know somebody in that project? Not just Bansari, in fact, 3 other people contacted me, ma'am, do you know somebody in that project team? So I told, no, the coordinator is not somebody I know, but I knew that person, but not like on a one-on-one basis. So this is how you kind of build up, if your professors know you're interested in research, they might recommend you for this kind of a post, So it's very important to be in touch with your professors when you're talking about nutrition research as a profession. And lastly, I would like to say one thing. Research, all of us, if you all are doing masters, your opportunity starts at your master's level. Publish papers, because only when you publish papers and show it on your series will somebody employ you. I very recently gave example to one of my students. He's like, ma'am, I've applied for internship at this XYZ place and I haven't heard back from that person. So I told, what, if you're interested in research, just type in another mail stating, I know that person is super interested in research, and if you say you're interested in research, you'll get an internship immediately. I do know all the nutritionists want to publish, because it's not just a way of showcasing what you're doing. It's also a form of recognition, not just for awards, but by your community also. So even within the community, your respect increases if you're doing research. And one last point, zaruri nahi hai aap job karo to do research. Okay, with Google Forms, after lockdown, research has become very easy. But research is not a one-person job. It's a teamwork. Okay, so just simply 2 of your friends getting together is also enough. Like my research career at Kokilabein started because with my friend who's at Kokilabein, she's like, Neha, I want to publish something. I want to do a research work, And I'm like, okay, fine, let's do it. So it was just a random talk between 2 friends who, and frankly speaking, we are like literally normal friends, I wouldn't even say that we have been besties by this. Now I can say she's a very good friend of mine, okay? But tab tak, jab tak maine Kokilabein join kiya, I would say she was like a batchmate to me. Yes, of course, I don't think I have bad relations with any of my friends, but it was not like hum besties hai, aisi zaruri bhi nahi hoti hai cheeze, So you can just form collaborations with just your friends who are not like, you don't need to be pals with your friends to work with them. Just simply call them, get together, crack on an idea and get going. So that's my life journey. And as others, I'd be happy to take any questions.
Thank you, Neha. And I think there are quite a few people in the panel who are guiding master students, and they will understand what you've just said. Research क्यों करना है? So I think आज बच्चों को पता चल गया होगा कि research क्यों करना है. And research is not, it's not rocket science. It just requires you to have rigor. It just requires you to have a will. It just requires you to be inquisitive, have questions, and try and find scientific explanations to the questions that you have. So thank you. I thank all the panelists. I think it is now time for the question and answer session. And I can see the message section on Zoom. A lot of appreciation coming our way. One of them has written, after Mahanur is writing, after listening to Lakshmi ma'am, undoubtedly research is my priority. So inspirations are already, already through. One question for Shreya would be, can an RD also be a sports nutritionist? Is RD necessary to be a sports nutritionist?
So it will just add on a lot of value to you, because when I connect with people who are internationally practicing, definitely I know people who are in US who have RD as one of the qualifications attached to their name, even though they are sports dietitians or sports nutritionists. So definitely, because in sports nutrition, it's just not that you're planning diet for an athlete or for their performance. There are sometimes, and even when we practice, there are a lot of clinical cases that are along along with the athlete, or when we are handling a Paralympic athlete, for example. So definitely there should be a good combination of the clinical nutrition as well as the sports nutrition, which you can practice, which you can actually educate your athlete about. So it's definitely going to add a lot of value. But like I already mentioned, make sure that you have a master's degree in sports nutrition along with RD, so that both the things can work in favor of what you're doing. So, yeah.
To enhance your qualification.
Correct.
That depth of knowledge.
Right.
And I think this question is very entertaining. And any one of you can take this up. How to become a celebrity dietitian?
I'll take it.
Okay.
So the thing is, to sum up in a word, you have to become a celebrity to become a celebrity dietitian.
Correct.
Now, how will you do it? It is your validated evidence qualifications that you have. Okay. Then the thing is, either take up an internship under these people. Okay. That is, for example, when the, Miss India comes up, there is a panelist there, so if you know the dietitian, apply for the internship there. Okay. And secondly, as rightly Bansari and Neha Sanvalkar said, take those pointers. You have the podcast. Now you have the Insta. It is how you sell yourself, right? In the actual words. So it is, you should know, because see, all these dietitians, if you want to see, they have the base, they have done exactly what we have done in our undergrads and our masters, right? Then it is your strategies. It is how you portray yourself, how plans you make. Okay. And that's how you catch up the clienteles. Okay. And so once you have the the practical experience under these people. So if you just recollect, every celebrity dietitian is just associated with one famous clientele. Okay. So you have Shilpa Shetty with Luke, right? Then you have Kareena with Rituja Divekar. So once you get that, okay, so it's how you portray your knowledge. And right now, as it is said, your qualifications does matter. Okay, so through that, you will become one.
I'd like to add one point. It's all about PR.
I
When
agree.
it comes to being a celebrity dietitian. So if you want to be a celebrity dietitian, have a good PR team. That will make wonders for you.
And
I would definitely agree with that. Like being socially active is going to help you become a celebrity dietitian. That is good. That is there. It goes without saying. Once you are more socially visible, you are more approachable, and people will come and contact you. So
I recently got to know one website called Makrak. Okay. It's a website wherein you, for journalists. Okay. I didn't even know my profile was already existing, because 10 years back, I used to write for the health site. So my website was created from the health site. And I got to know of this because I met somebody recently and she sent me her CV and she had a Makrak profile. So I'm like, Makrak kya hota hai? Mujhe pata hi nahi hai. So when I went and saw, it's for journalists. But if you go there and explore, even nutritionists or even people who write health and wellness columns, they can create their profiles on Makrak. So why not? That can be an extremely amazing PR tool for, any of us who publish in media. So actually, I did add my Nutrition Insight profile articles also to Makrak. So, anywhere you publish, that's a new PR tool, I think, which we don't know and we can explore.
And I think
nowadays there are a lot of platforms, actually a lot of platforms are available. And if not any platform, you yourself, you can grow and create your own blog site on WordPress. Like if you are so much into writing about nutrition, go and create a blog site on WordPress and start writing about it. People will read, people will recognize you. So quite easily done nowadays.
And I think one more thing that I would like to add. Sorry, Kajal, can I continue?
No, please go ahead, Shreya.
Yeah, I think, and dietitians should be going to a lot of events, like Purvi ma'am also said. Go out there, walk the talk. That's where you're going to meet a lot of people. Because when I also recently went for a Red Bull show run, which happened at Bandra, and the area where I was actually, witnessing the event, all the people were celebrities, all the people. So that's how you connect with them. So you need to get out of your comfort zone and meet people, talk to them, tell who you are. And when we also see a lot of people, like Purvi ma'am mentioned, be it Luke, be it Rujita Divekar, be it Pooja Makhija or whosoever, you have to see how they portray themselves. So you have to become like that. So if you are going to be dealing with a celebrity, you yourself should be looking like a celebrity first.
Yes.
And that's the main part of our job, because we ourselves need to practice
Yes.
what we preach. So yeah.
Yeah, I would like to add, Shreya, if you've done,
Sure.
just let's not be too intimidated by the word celebrity today. I honestly feel that the way we are looking forward to celebrities are also looking forward to people like us who are ready to pick them up and have them endorse. For instance, just giving you a quick example, we regularly put up our products at a pop-up flea at the Geo World Drive, which is in Bandra, BKC. I belong to Bombay. And I did take that opportunity up in the lockdown. At that point, no entrepreneur was ready to go during the COVID and be in a flea show, like a pop-up. And I did take that opportunity again to talk about the word opportunity. But coming back to context, there were so many people, actors, models, they would just pass by. And if they like your product, I eventually feel no matter how much we are ready to pay, no matter how much we are ready to pursue, and no matter how much networking we do, if what we offer as a service or a product is not good enough, then no matter the price you're paying, it could be a Mr. Dhoni who's going to be on board, or it could be an actor like Shahid Kapoor. But if that doesn't work, then it's money down the drain. So be very careful when we are pursuing. Let us actually work on ourselves, improve our service or product to such an extent where celebrities can pursue us. The game is changing, because even now they go to OTT, they do stuff that they are not comfortable with. They know there is an audience out there that they want to approach and they want to be visible. So right people, they will always look out for. So focus on the work, and eventually you will get calls your way.
And I would also like to add that a lot of quackery is very confident. Very confidently they post content. So people like us should be more confident. We can be more flamboyant, we can be more visible, and we can do much better. We should be doing much better.
So we started the NSI social media handles for the fact that we give an opportunity to the MSc, BSc and other nutritionists who are not confident in hosting their own handles. We provided them that platform that, okay, if you're not, you cannot generate some of those 20, 30 posts per month to keep your handle going, create for NSI Mumbai chapter. We are crediting, every creator is credited for their posts. And that is how NSI Mumbai chapter handle came about research-based information, but you cannot have your own handles. At least you are having some social media presence through NSI Mumbai.
And a very credible presence for that matter. Another question I think this should be answered by Neha Arora is elaborate something on child nutrition. Is there something that you want to say about, how nutritionists can be more effective in the field of child nutrition?
So one of the things that for child nutrition, see, you have to not look at it as a general form of nutrition practice. So you would need to specialize yourself. That is required. So that is either you work with a pediatrician. That is one of the ways you can specialize yourself, or you can do specialized courses for child nutrition. Like example, you have the BPNI Breastfeeding Promotion Network of India does a 7-day residential course which you can take up, because you will learn hands-on, also a lot of practical guidance on breastfeeding. Plus you will learn about the guidelines which are being used for complementary feeding. And then there are also some international courses. Again, when I tell you all to look at courses, see, there are many courses that are being through some type of companies, or back through some products. I would not say those are the right courses to go with. Try to look for courses which have a tie-up with either with government. So you have NPTEL courses which are tied up with government, or which has your BPNI courses 50% funded by government, plus a lot of the trainers are working with government offices already, or hospitals, uh, or some courses which are tied up with universities. So like one of the courses which is online on infant young child nutrition is tied up with University of Cornell. So those are the type of courses that you can do to specialize your technical knowledge on child nutrition. And definitely nothing beats the practical experience that you will get while working on with children. And so that is only through if you work with a pediatrician or a pediatric hospital where you can specialize yourself further.
There is also a course by Dr. Rupal Dalal on Swayam,
Yeah.
which
So
is maternal, infant, and young child nutrition, which is a very good course. The girls could also
Yes.
take that up.
There's also Early Nutrition Academy, which provide credit-based courses in maternal and child nutrition, which is also a very credible courses. And I've taken some of the courses there. It's really very well made course content.
Yeah, they are the ones which are tied up with that German university.
Mm-hmm.
Yes.
Now, this is a question which I would like to direct to Kajal. What are the licensing needs if you have to start your business?
If you, for the food industry, right? Yeah. So, of course, for the Indian subcontinent, for the Indian landscape, definitely the FSSAI is mandatory. And if you're going to sell a product, then there is weights and measures, which is the legal metrology certification, which is required. If you're doing it out of a home, I think FSSAI has recently changed their norms because a lot of home chefs did come up in the lockdown. So if you're doing it from a home, they do check up a few legalities and things like if you're showcasing that your product is gluten-free, then what kind of arrangements are you making that your kitchen pantry is free from gluten and things like that. As far as the unit that I am a part of, I did get inspections for the quality of water at the unit that I work at. What kind of people I'm employing, what are the hygiene standards. If you want to, so these are the ones for India. Now, if you want to export, so we are looking at exports this year. And so if you're looking at exports, then there is a separate license overall because the health hygiene standard of every country is different. For instance, Middle East requires a health certificate from the Indian government and from the manufacturer. US will require a different FDA certification. Europe requires a very, very stringent regulation. And forget all the countries if you're not exporting. But even in India, like I mentioned, that we are talking to some airlines, right? And I did work with one airline before the lockdown. They did go through every process of the production, which I wasn't very happy about, but I had to showcase it because if they are going to serve to their customers on a flight, they do want to know the quality and the stringent regulations. So you will have visitors coming to your unit, depending on what channel you want to follow, what you want to showcase and portray. At the same time, there is enough business that is happening online. So if you're in an online business, then there are trademark regulations, of course, trademark certification. I'm saying things randomly, but just note it down as a list. That trademark certification also, there are trademark, the government has trademark certification for startups that's at a very discounted price. And all of you must know that as women entrepreneurs, if you start something, then the government does invest in you. Okay, that's something that unfortunately came after I started the company. But irrespective, I think all of you can enjoy that benefit if you want to start a unit. Of course, there are procedures for that as well. Each government is going after initiating a women entrepreneurship workshop, women entrepreneurship sector, especially in the food industry and especially in the millet-based industry, as I was sharing with you guys. So yes, it does involve a couple of expenses, couple of certifications, discounts are provided in each. I'm happy to share it on a separate note if you DM me separately. But it does become a little bit of an initial expense, but it does become worth it because then your product is open for the market to buy. All right. So I hope that answers that question.
Yes, it does. And
yeah, and that's why I mentioned, sorry, ma'am, Amrita ma'am, that's why I mentioned in my journey that I forgot to share about finance learning, which is a critical part before one becomes an entrepreneur. So yeah, that is pretty intrinsic to the entrepreneurship
must
journey.
make yourself aware of
Yeah.
those processes.
I'd like to ask the
yes.
same question to Shreya actually, if she's setting up a clinical practice, because a lot of them would want to work as, clinical nutritionists, but have their own setup. What sort of licenses would you read in that setup? Because I'm sure a lot of our viewers would benefit from that. What licenses would you require to work as a own setup?
Own setup, right? So for until now, like everything what we are doing is online, but like how Kajal also said, definitely trademark or registering your own brand becomes very crucial. And before that, the first process that one needs to do is get a shop act, irrespective of whatever kind of services that you're providing, because that is one of the major documentation that you would need for rest of the things that you're doing. Udyog Aadhaar is also one of the documents that one needs when they are starting with their own setup. But that is actually more important to understand and get the process going for the trademark as well as registration that you're going to get for your own brand. So this is for with regards to the initial processing that one needs to do when they have to start with their own brand or own practice. Apart from that, for example, if it's a particular place where they're starting with their own practice, then definitely they need to get certain documentation done for the place that they have hired or whatever it is. We do not have a physical setup as of now. So I won't be able to give much justice to this information, but I think this 4 points is something that definitely I think one can start with, because even if you have to practice online or even offline, this would be mandatory. Definitely, if because we are also handling a couple of international clients online, it becomes easy. But when you go abroad and practice over there, there are certain examinations that one needs to give, certain licenses that one needs to have to practice in other countries. So every country has their different rules and certification that one would need to practice over there. So yeah.
Thank you,
Shreya, I think Shreya was mentioning a Gumasta license. If you set up your own unit as a clinic,
right,
you need
right,
a Gumasta license.
That's a basic. That's
Now you have the Udyog Aadhaar.
Udyog
Gumasta is no
Aadhaar,
longer
Udyog Aadhaar.
applicable. It's Udyog Aadhaar now.
Now the next couple of questions are for Bansiri. The people are asking whether, this is a question from YouTube, whether a graduate can also be a content writer. Is there any qualification, minimum qualification necessary? And a very important concern that Madhvi has raised is the awareness regarding copyright issues to prevent plagiarism.
Yeah. So I would like to definitely address this question. So when someone is asking that whether an undergraduate can be a content writer, so minimum qualification itself becomes undergraduate, because undergraduation is a minimum qualification for a particular subject. If you are writing on a particular subject, then the minimum qualification to take about, or to the learning to take about that subject would be undergraduation. So to become a content writer, the first minimum qualification, according to me, would be at least an undergraduation in that particular subject, what you're willing to write. And apart from that, some writing skills courses here and there, which you can take along with your undergraduation to improve your proficiency in the subject or in the language what you are going to write. So for example, if I'm going to write into English, then my proficiency in the language is very much important. I cannot go ahead and start writing in a language which I am not comfortable or in which I am not going to able to address the subject which I'm willing to. So minimum qualification becomes undergraduation. And apart from that, some writing skills here and there, which are available online, where you can do it from Coursera, from Udemy. Apart from that, a lot of art colleges are also providing short-term certificate courses. So one of the colleges, Xavier's College of Mumbai, is also providing a short-term course on content writing. So you can go and take up those courses. And I myself, I have started with content writing in nutrition and dietetic courses, like a short 1 week course where I teach students into nutrition and dietetics, where they can write about nutrition and dietetic into a much more scientific content. So you can take up some or the other course in content writing.
If I may add, on a light note, as a teacher, I think your content, or as a student in a college, your content writing starts with your assignments.
Yeah.
That's probably your first step to putting it all together. See that it makes sense and it's just not random pieces of information that you've put through. So take your assignments in college seriously, and probably that'll pave your way forward to becoming a good content writer.
Even paper
And
publishing, where
even
Neha ma'am
there,
had
the
mentioned.
plagiarism should not be there. Just cut, copy,
Absolutely,
paste.
which is
It
why
is
now
very important. That is the reason why undergraduation is very important. If you are undergraduate about
And
the
I think
subject what you
Madhuri
are
ma'am
writing,
is emphasizing on that cut, copy, paste option, and she has also gone through, and Amrita ma'am will also witness, so as Neha ma'am and Lakshmi ma'am, that when this writing part comes, we forget our English precisely and honestly. And it was just a cut, copy, paste, then we have to find out where the content goes. There is no trailer of that writing. And I was
when we are writing a content, it is very much likely that you will go and do a research on the topic what you are writing. So taking reference is different and cut, copying, paste is different. You read about something and create a content out of it is going to be your original content. And going and cut, copy, pasting and writing it into your content is obviously plagiarism, which is ethically very wrong. You are using someone else's content under your name. So it is illegal to do that. So make it a point that when you are writing a content, do not cut, copy, paste. Definitely take a reference from it, take a learning from it, but do not cut, copy, paste. That is there for sure.
Rupali ma'am, would you like to add something about plagiarism checkers on this point?
Yeah. Coming to this assignment part, research writing part, content writing part, thesis writing, every literature writing part, not on in our college, every universities, they have a plagiarism check device, authenticated, approved by UGC. So as per the UGC guideline, 10% similarity is only accepted. And if it is 10.1, your entire content, what you are writing, will get rejected. So this is a UGC guideline which we follow. In our institution, we have a deliberate. Every thesis goes through that plagiarism check. And in that, if the students or if anybody gets more than 10%, again, they have to redo the work, resubmit, and unless and until it comes 10 and below 10%. Then only it is accepted thesis, otherwise it is disapproved. It is not in my college, it is in entire university, this rule has come up. So one has to be very, 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 careful while they write the contents. The entire intention of Lakshmi ma'am telling is that your assignment, because your primary work starts from there, then only you go for your dissertation. At the undergraduate level, nobody will ask you to write a thesis. There, your assignment will be checked, the way you are writing the answer. Exactly like you write the answers what the teachers or the professors are teaching you, and there is no research to that answer and added research from the library. That is what we always keep telling the students. Then we give up at one point of time. So this is what plagiarism checking is very important for every content writing courses and on everything, whatever the queries we are getting over here.
In your professional career also, if you are a content writer and writing a content for a newspaper, for a magazine, even there, when you submit an article, plagiarism checker is made. 10% is what UGC is doing. 7 to 8% is minimum what a newspaper, a high-end newspaper like Times of India has a 7 to 8% of range where they accept plagiarism or similarity of the article what they are taking in. So that is the same even we do with our magazine. That is what we allow, only a 10% of similarity. So any article which has been given to our magazine for publishing it, we definitely run through a plagiarism checker. And then only after that, the article is being published in the magazine. So it becomes very important to avoid any cut, copy, pasting.
Absolutely, absolutely. Lakshmi, could you please tell the girls whether it is important, whether a student who's done NSC in sports nutrition can appear for the RD exam?
To my knowledge, no, because there are certain subjects which they need to fulfill and which are primarily dietetic, therapeutic, clinical based. And as far as I understand, sports nutrition may not cover them all, because I think the focus completely shifts to nutrition for different sports populations.
Yes.
So if my knowledge goes right, no.
No, not at all.
Yeah, so maybe an MSc C&D student who can do an RD, if she wants to do sports nutrition,
They
she should
can.
qualify herself with some sports nutrition.
Yes,
And
yes.
Which
a
is why-
person who done MSc sports nutrition can be a sports nutritionist.
Yes,
without
an
RD,
MSc,
Without
yes,
RD.
yes.
Without-
And I think which is why now, I'm not sure if it applies to the students coming in, but this nutrition the new education policy that's coming up is going to give more, scope for taking up subjects which will help probably students who are interested in both lines of work or who want to do things simultaneously, just to see where they stand. So
Right.
let's hope and pray that that works well.
There is
No, but
quite
add on
a
to this,
flexibility in
can I
the-
just add on? Because I'm an RD trainer. So the thing is, as rightly as Lakshmi ma'am said, because in RD, what happens is more therapeutic, it's more clinical. Sports science becomes a part of it. More emphasis on biochemistry. There is the pathophysiology, which is there, the anatomy, which comes in, the clinical therapeutic nutrition, which is there. And moreover, it is more practical based, because when these girls come for internship, those 50 case studies that they handle is all clinical. So that is how they know how to interpret a case. And, when they work upon 50 case studies to go in, so that gives them the knack of understanding, the case specificity. So if that is the thing, apart from that, if they do a clinical, any of the postgraduate courses and then come to RD, it can be done.
Minimum of 4-year nutrition background you have to have there. So that is the prerequisite to appear for the RD exam. Nutrition background you have to have there. PG diploma 1 year in dietetics you have to be there. Sports nutrition if you have, no, you are not entitled for RD exam. So your basic qualification should be food science and nutrition, or nutrition and dietetics, or food nutrition and dietetics, or applied nutrition.
So I think that's it as far as the Q&A for the panel discussion is concerned. We seem to have covered a wide range of questions, a wide range of topics. It was very informative for me. I'm sure it was very informative for our participants as well. And I will now hand over the session to Dr. Rupali Sengupta for the closing.
Yeah, thank you so much, Amrita ma'am, for hosting the entire show. Before I end up, myself, Dr. Rupali Sengupta, as a secretary of NSI Mumbai chapter, it's really the entire day we spent on this. After a long gap, this webinar we have organized, we did not get to know what time now it is, because we are so much into that, engrossed into this today's evening. I would like to thank Dr. Sadhna Joshi, our keynote speaker for today's webinar. And really, ma'am, it was insight you have given on the women's health, and your thought-provoking presentation was really one which we will remember. And your each and every slide spoke about the entire women health and its way the one should take it forward. Coming to the panelist part, because this is the part which I have seen the entire student forum who were asking the question and the queries were there. Each and every panelist have given the different diverse background which they belong to, and the way they have explained the queries raised by this participant. And with this, I would like also to thank Dr. Neha Sanvalka, the very proactive LEC member of NSI Mumbai chapter, Miss Amrita Bahl, ma'am. She is also an LEC member of our NSI Mumbai chapter. So as I can see, Miss Sonu Mishra, she is also one of our social media member of NSI. Dr. Lakshmi Menon is also our member. So like NSI is more of a fraternity. We all have come together because your admission is coming in the month of June, and we thought that we should take up forward to make your give you the guidelines and make you aware what are the fields you can explore for your future prospect. And if there are any queries and if you want to connect with any of the speakers for today, please mail to us at our NSI Mumbai chapter email ID. We will post it in our chat box. And before I end, I would also like to thank our convener, Mrs. Anuradha Shekhar. Ma'am just needs one blow and she will start the entire thing. And last but not the least, our mentor, Dr. Shubhadra Mandalika, who has always been supportive, and from the back end, she will say, yes, we can do it, go ahead with that. And with this, I would like to thank each and every one, and especially the participant, for listening to us very patiently for the entire day. Thank you once again. If any, I think email IDs are given in the chat box. Please mail us, and any of the speaker can be at one go in touch with you with your queries. So with this, I would like to hand it over to Neha, ma'am. Neha,
ma'am, just one point. Please fill the feedback, everyone. That's it. Thank you so much. So, the links have been shared with the Zoom link.
Yeah. Thank you so much.